Welcome to Community Health Heroes Show, where we spotlight local organizations that provide much-needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Today on Community Health Heroes, we'll be speaking with Dr. Vernon Carrier, Jr. of Metairie Gastroenterology, who will talk about the prevention and treatment of colorectal cancer in recognition of Colorectal Cancer Awareness Month. Nelson Rains, Director of Sales and Account Management at United Healthcare, who will tell us about the upcoming United Healthcare Ride to Recovery 2016 Gulf States Challenge and the United Healthcare Children's Foundation Golf Classic. And on today's Eat Fit NOLA cooking segment, we'll be in the kitchen preparing coriander tuna with Will Sampson of Vega Tapas and Molly Kimball of Eat Fit NOLA. So don't go away, we'll be right back with more Community Health Heroes.
How do we show our gratitude for our active duty military and veterans? The Disposable Heroes Project is a nonprofit organization serving all branches of the military and their families. Their mission is to recognize, honor, and support our veteran and active duty personnel in any form of assistance they may need. Visit dhproject.org now and donate or purchase merchandise to show your support. dhproject.org. It's your turn to serve.
Welcome to Community Health Heroes. March is Colorectal Cancer Awareness Month. Did you know that approximately 5% or 1 in 20 Americans will be diagnosed with cancer of their colon or rectum in their lifetime? Joining us today to discuss the prevention and treatment of colorectal cancer is Dr. Vernon Carrier, Jr. of Metairie Gastroenterology. Welcome to the show, Dr. Carrier.
Thank you. Thank you, Dr. Walker. It's great to be here on behalf of the Louisiana State Medical Society and Jefferson Parish Medical Society.
Well, thank you. So I understand that March is Colorectal Cancer Awareness Month.
Yes, it is. It's a very important month. We as gastroenterologists really like to push colon cancer awareness, and it's nice to have an entire month that is dedicated just to colon cancer awareness.
So you tell me some of the signs and symptoms of colon cancer that people should be aware of?
That's a great question. Colon cancer is a cancer of the large intestine. The large intestine is the end of the intestinal tract. Because it's the end of the intestinal tract, the way that symptoms usually present, the biggest one is blood in the stool. Mm-hmm. The next thing can be change in the stool caliber or consistency. Mm-hmm. And then if the cancer progresses, you can actually get obstruction, where that can lead to nausea, vomiting, abdominal pain, other symptoms like that.
So how can somebody prevent colon cancer? Is it like diet? Are there other things involved? What's the type of prevention you would recommend?
That's another great question. There have been a lot of studies that have looked at different ways of preventing colon cancer. The most important things are going to be what we recommend for almost all patients: diet and exercise. Diet, mostly a lot of fruits, a lot of vegetables, regular exercise. There are some other risk factors for colon cancer, such as tobacco use, obesity. And also there has been some evidence showing that processed meats and red meats, high intakes of those can also increase your risk for.
So really not just eating the fruits and vegetables, but avoiding some of that processed meat.
Exactly. No, there has been some evidence showing that some of the processed meats not only increase your risk for colon cancer, but some other cancers also. Mm-hmm.
And how often should one have a colonoscopy? That's usually the test that you would recommend, correct?
That is. So colonoscopy is kind of the gold standard. Mm-hmm. So colonoscopy in general, for the average risk person, we start at age 50.
Okay.
And then it depends a lot on what you find. So if you find polyps, it can be 3 to 5 years, depending on the size, how many you have. And if it's completely normal, it could be 10 years.
Okay.
There are other screening modalities also.
Well, tell me about those.
Yes, there are. And there are ones where we can check for blood in the stool. There's an older one called the fecal occult blood test. And then there's a newer test called FIT testing. It's a special stain for blood in the stool. Both of those are where you get a sample of stool, you send it in. There's also a newer technique called Cologuard. It's been out for about a year or so. And that's actually, you get a sample of stool, we send it in, and they actually do some further analysis on the stools to look for different things, such as blood in the stool, special markers, other things like that, that can detect for colon cancer also.
And who do you recommend those tests for?
So first off, we recommend everyone get some type of screening for colon cancer. The problem is, I think a lot of times is people have fear, they have these notions in their minds of, oh, if I get a colonoscopy, it's going to be very challenging. So we want everyone to get screened, period. Colonoscopy is usually the best test, but for people that either don't want to do a colonoscopy or have other ideas, want to do something different, that's when we offer the other options, such as the stool testing, flexible sigmoidoscopy also, which is a short colonoscopy where you don't go all the way around. And then there's also something else called virtual colonoscopy, which is actually a CT scan. You have to get prepped just like you do for the colonoscopy. They inject some air into your colon. They scan you through the CT scan machine, and they can look for little polyps. Now, if they do find something, unfortunately, you still have to have the colonoscopy.
Right, so that's why the colonoscopy is still the gold standard.
It is, and we've made improvements with it. The hardest thing with colonoscopies is the preparation. The gold standard, the good old tried and true test is the Go Lightly, which is a big gallon, and everyone has had horror stories. I had to drink this gallon of stuff.
Right.
We have a lot more improved, lower volume preps that are just as effective as the Go Lightly. So that is one of our big barriers to colonoscopy is kind of alleviating patients' fears of the preparation. The procedure itself, once patients get there, they get an IV, they get sedated. The procedure itself is very easy for patients. The sedation we use now works very quickly, wears off very quickly. Patients are usually waking up asking, when are we going to start? And we're like, it's time for you to go home.
Aw, that's good. They alleviate a lot of fears.
It does.
So is there a certain population that should be a little bit more worried about having colon cancer or more susceptible to colon cancer?
There are some people at higher risk, people with family history of colon cancer. If you've had any first degree relative with colon cancer prior to age 60, that increases your risk and so you need to be screened more often and earlier. And there's also some people that have hereditary diseases that actually need to be screened all the way up to possibly 25 years old being started screening.
So if you're African American or have a family history, you really need to talk to your doctor about when you should start your screening.
You are 100% right. The most important thing about colon cancer is early detection. And the reason that's important is that we can prevent colon cancer with removing of polyps. And also, if you do have colon cancer, we can actually treat it and cure it a lot better if we catch it before you start having symptoms.
Okay, so the colonoscopy is important to recognize polyps, which could turn into cancer.
Exactly, yes. So it's very important to get the polyps removed. You get the polyps taken out, that will prevent cancer. And then also, if you do have a cancer, hopefully it's an early stage cancer, which will allow, if you do have that, more likely to be able to be cured of the cancer.
So colon cancer could be curable.
You are 100% correct. Yes, it can be. But the most important thing about colon cancer is early detection. The best thing is prevention, but if you are going to develop colon cancer, you want to catch it early, because if you catch it in the earlier stages, the likelihood of having a cure is a lot higher than if you catch it later on when it's more advanced.
So if you needed to set up an appointment with your doctor, you just call your doctor, or how does somebody get referred to a specialist such as yourself?
So usually what we recommend is a primary care doctor is usually kind of a gateway doctor. So they will have these discussions with the patient, say these are different options, And then once they have that, if the patient has further questions, always get referred to the specialist to discuss the options. And if the patient would like a colonoscopy, of course, get referred to the specialist. And in that way, the doctor can talk to them about the procedure itself, what the options are, and then how the preparation and other things like that, which is very important for the procedure.
And if our audience want to find out more information about colorectal cancer, where could they go for that?
So there's a lot of different websites for colon cancer awareness. We often recommend patients going. You can go on the internet, type in colon cancer. There's all kinds of different resources that are there, and your primary care doctor is a great source of information and wealth of information on this topic.
Well, thank you so much for being on our show today and providing this valuable information.
Well, thank you so much for having me.
When we return, we'll be speaking with Nelson Rains of United Healthcare, who will tell us about their upcoming Ride to Recovery Gulf States Challenge and the United Healthcare Children's Foundation Golf Classic at Chateau Golf Club in Kenner. So don't go away. We'll be right back with more Community Health Heroes.
My mother shaped me as an actor, as a musician, as a human being. So when she was diagnosed with colon cancer, it was like our entire family got cancer. And she died when she was only 56, so this is personal. And hopefully my heartbreak is your wake-up call. You can prevent colorectal cancer. If you're 50 or older, get screened. Screening saves lives.
Spring is filled with lots of exciting events for every member of the family to enjoy. Joining us today to talk about two very special events that United Healthcare is sponsoring that will recognize our brave veterans and raise funds for children medical grants is Nelson Rains, Director of Sales of United Healthcare Gulf States Region. Welcome to the show, Nelson.
Thank you so much for having me, Penny.
So you have two great events coming up soon. One is the Gulf Coast Challenge. Can you tell me about that?
Yeah, absolutely. The Gulf Coast Challenge is part of the Ride to Recovery Foundation, and United Healthcare has been fortunate to be the presenting sponsor for Ride to Recovery for 7 years now. There are 6 events that take place throughout the year, and the one that we have the privilege of being a part of starts this Sunday in Atlanta.
Wow.
And so, yeah, it's a 400-mile bicycle ride with stops along the way in Columbus, Georgia, Tuskegee, Alabama, Selma, Alabama, Gulfport, Mississippi, and it ends next Friday here in New Orleans. We're expecting over 200 cyclists and supporters. Ride to Recovery is a rehabilitative program that is geared towards veterans suffering from psychological or physical injuries. It's a tremendous event. I actually had the opportunity to ride in it a couple years ago, and I made the ride from Gulfport to Mobile. So it's a wonderful event, and we're encouraging everyone who is along the route to hopefully come out and support the riders. It's a wonderful time.
And how can they find more information about this event?
Yep, absolutely. You can go to www.ridetorecovery.com. That'll give you a breakdown. There's actually some live feeds on there as the cyclists come by. You can actually cheer them on online if you're not able to make it out in person.
And you can actually join the ride if you want to.
Yeah, certainly. You can absolutely ride along. You can do a partial, you can do a 1 day, or if you're up to it, you can ride the entire time. So.
And this is a donation, so there's funds donated for the Ride to Recovery?
Yep, the donations come from United Healthcare. There are other sponsors along that sponsor the event as well, but United is the presenting sponsor and has been for the past 7 years.
And the money goes towards helping our veterans that have had some problems?
Yep, absolutely. Psychological and physical rehab initiatives that take place, whether they're at military institutions. They also provide veterans with either traditional bicycles for road bikes, or modified bikes, or tandem, or the recumbent bicycles for those with disabilities to be able to take part in the ride. So
that's awesome. And then you have a second event, your Children's Golf Classic, correct?
Yep, that's right. That takes place on Monday, April 4th. The United Healthcare Children's Foundation. It's our annual tournament that we host. This year we have the luxury of having it at Chateau Golf and Country Club in Kenner. It's a wonderful course. If you haven't played, I encourage you to go play it. And it's going to take place on Monday the 4th. Some of our sponsors for that include Hub International, Arthur J. Gallagher Insurance, as well as several individual teams that have also gotten involved with it.
So tell me about the Children's Foundation.
So the Children's Foundation is really neat. It's a foundation headed up by United Healthcare, and what we do is we actually identify gaps in care, gaps in coverage. So for individuals that say you can't have a financial need and they can't meet an out-of-pocket or some type of deductible, United steps in and fills that. And it's not only for United Healthcare members. So if anyone is on another commercial plan, United Healthcare Children's Foundation is able to step in and fund that for them.
So you need to have commercial insurance, and you need to have a child that has a need.
That's correct.
And then it could cover like possible like standers or some walkers or
Yep.
wheelchairs or something that they may not have full coverage for.
Correct. Whether it's not full coverage for it or it's maybe a non-covered benefit, the Children's Foundation can step in and help fund that for them.
And how do they find out, how do they apply for a loan, or I guess it's not a loan, it's a grant. How do
Yep.
they apply for a grant?
You can go to www.uhccf.org, and all the information is listed on there, and that's how you can apply for a grant as well.
And they're like reviewed every month, and so you wouldn't be waiting like a year for your answer.
That's correct, absolutely.
Okay, well that's just awesome information. So we got two great events right here in our own hometown, and how do we find out more information about United Healthcare or the foundation?
You can actually go to uhccf.org as well. There's tons of information on there about the foundation, actually where the dollars go, and a lot of them stay within our own area here, as well as outside the region.
Well, thank you so much for taking the time to be on our show today.
Thank you for having me.
Coming up next, we'll be talking with Will Sampson of Vega Tapas Restaurant when he and Molly Kimball of Oshner Elmwood Fitness Eat Fit NOLA program join us in the kitchen for another exciting episode of Eat Fit NOLA Cooking. So don't go away. We'll be right back with more Community Health Heroes.
I'm Molly Kimball, registered dietitian with Oxner's Elmwood Fitness Center. We've collaborated with more than 60 local restaurants to create Eat Fit NOLA, a partnership that highlights the better-for-you items right there on a restaurant's menu, making it effortless for you to dine at your favorite New Orleans restaurant without ditching your otherwise healthy diet. Every month, the Community Health Heroes Show will shine a spotlight on one of our city's incredible chefs who will show you how you can make healthier choices when dining at theirs or any of our city's great restaurants. So don't go away. Community Health Heroes will be right back.
2 outs with a runner on first base. Now the big guy comes up the bat, hitting .342 with 92 RBIs and 36 homers.
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Welcome back. Joining us for today's Eat Fit NOLA cooking segment is Will Sampson, Executive Chef at Vega Tapas Cafe, and Molly Kimball with Oshner's Elmwood Fitness Eat Fit NOLA program. Thanks so much for joining us today on the show.
You're welcome. I'm proud to be here.
So what are you going to be preparing for us today?
Today we're going to be preparing a coriander tuna. It's a seared tuna that's crusted with coriander and salt. And we're also going to make an avocado puree.
And that's for the tuna?
Yes, ma'am.
All righty. So tell me a little bit about coriander. I understand it's some kind of seed.
Yeah, it's come from like coriander seeds. You know, you could like finely grind it, and you do all kind of stuff with it.
So on the dishes, the tapas size, about how many calories are in each dish?
So when it's the Eat Fit NOLA approved tapas size, that means they're under 300 calories, and then they're under 400 milligrams of sodium, which we base that on the American Heart Association's heart check mark guidelines, and then very low in animal-based saturated fat and very, very low in added sugars. And so things like the avocado puree are perfect because it's the Heart Smart fats with the avocado. And so we're using that as a base under the tuna.
Okay.
So again, easily avoiding the white carbs, the high animal-based fats. So,
All right. And about how many Eat Fit NOLA dishes do you have on the menu?
with Vega, there's about 4 to 5, and so the fish of the day often is Eat Fit NOLA approved, but since it varies and Chef
Okay.
Will gets creative with the side items that go with it, that it doesn't always have the seal on it, but a lot of times it still is. So there's a lot of really healthful options.
And so we're putting in some avocado. It looks like we have some cilantro.
You're going to put some cilantro. I can put cilantro in at the end.
Okay.
Got a couple of garlic cloves.
A little bit of garlic.
And is that raw garlic?
Yes.
Okay.
And we also add a little lime juice.
Okay.
So far it's avocado, garlic, lime juice, and just in a food processor at home, someone can do that.
Also have a little red wine vinegar.
Okay.
And interestingly, now with Eat Fitnola, we have the Eat Fitnola app in conjunction with Fitnola, which is part of the city's organization, and it's free. So when you download the Fitnola Eat Fitnola app, you can find Chef Will's recipe for this. Will be on there.
Great. And then I understand that you might be at an upcoming event, the Home and Garden Show.
Yes. So Chef Will be with us. We've got all day Friday, Saturday, Sunday, March 11th through 13th. We have the Eat Fitnola cooking demos that we'll be having at the Superdome, where Chef Will with Vega Tapas Cafe and other chefs will be every hour. We'll have different demos.
Wow.
So this, I watch him doing this, and that's not how I separate the egg yolks, but it's how he does. So it's the yolk only, correct, in the puree?
Yes, just the yolk only, and it's okay to get the egg whites in there. It's not gonna harm anything.
And one of the misconceptions about eggs is people think that they're really high in saturated fat, and they're not.
Okay.
And eggs are high in cholesterol, but we've learned just over the years that cholesterol that's in food doesn't really have an effect on our cholesterol levels. So something like eggs are not limited on Eat Fitnola. And so again, kind of a misconception on that saturated fat. So is that garlic?
Horseradish.
Horseradish. Okay.
Kicking it up a notch.
Yeah.
I'm going with the sticky yolk. Last one, add all the cilantro.
You had the stem off.
Yes.
All right.
You just toss that in there.
Citrusy taste.
And last, we just add our salt and pepper.
I do feel like at home, though, if someone's making this, it's a great complement to anything. So
It's
if you
like a dip, or you can put veggies in it.
Yes, you can use it as a dip, all types of stuff.
pair it with chicken, it just is going to make anything more interesting. Because if you're going to making the whole batch of it, you can certainly use it for other dishes.
So next we're gonna get our pan started. Start searing the tuna, the olive oil.
Now, if someone wanted to do the avocado puree and just dice up the avocado and kind of stir it up, could they do that?
Yes, you could like small dice it, add small diced tomatoes to it, green onions, make a relish out of it.
Okay.
So,
Very versatile.
Yes.
Getting creative with it. Okay. And then, so we've got olive oil heating up the tuna, and this is just beautiful, super red tuna.
Yes, that's a very fresh tuna. Actually, it's a bluefin tuna.
Okay.
And because there's a big difference between fresh tuna and frozen tuna. Frozen tuna, like if you ever go to a restaurant and you see a tuna that's like bright red, that's frozen tuna. Because usually they gas it and they freeze it so it can preserve. But fresh tuna, it have like that soft texture, kind of darkish, reddish color.
Like this is just beautiful. I don't know if y'all
We're
need
going
to
to switch
switch.
over and we're going to start preparing our tuna.
So first we're gonna coat it coriander, salt and pepper.
Okay. Easy. The hardest step here is finding such beautiful fish to do this with.
I just want like a little light coat.
And we would have our skillet hot and get the sizzle?
Yes.
Okay.
And usually I just sear it for like 10 seconds aside, depending on the size of the tuna.
Dr. Walker, do you eat sushi?
Yes.
Okay.
Yes, absolutely.
This is
Sushi grade tuna.
It is. It is my favorite dish at Vega Tapas Cafe. But for someone who doesn't like it, Chef Will can always do it more well done. Okay. But you probably cringe when someone orders it that way, huh?
Yeah.
You're really eating a beautiful piece of tuna.
Right. And then we've got the other dishes. Do you want to tell us what else we've got that's Eat Fit?
Yes, we also have the Vega salad. It's a very healthy salad. All this is spring mix, pita bread, toasted almonds, and sun-dried tomato vinaigrette, which works well with the salad. And here we have a seared drum over quinoa, and also toss it with peas, cherry tomatoes, and it's a reduction.
Okay.
Vega Tapas was one of the first customers that joined Eat Fit NOLA. Can you tell me how that happened?
Yes. So when we started Eat Fit NOLA, we did kind of our pilot in the summer of 2012, and we had a few key restaurants that we knew that they knew me, they trusted that this was going to be something that they would go into this venture with. And so with Vega Tapas Cafe, went to the owner and said, hey, this is something we're launching. Do you want to do this with us? So Vega Tapas Cafe, Commander's Palace, and Muriel's were our first 3 Eat Fit restaurants. And we kind of got our feet wet with that, figured out what our system's going to be, and then really did our full steam launch spring of 2013.
And where do we find your location?
Actually, we're located in Old Metairie, 2051 Metairie Road. It's like right between Bonneville and the same strip with Oscars and Mark Twain's. So
it's a great atmosphere, really cool date place, girls' night place, lots of fun.
Very laid back.
And low calorie and healthy.
Right.
Low calories, healthy.
And so with this, I know the presentation is just incredible with this. So
yeah. So now we're gonna take our avocado puree.
It did pick it up really nicely.
Yes.
That smells so good.
That's what you're looking for, the nice and creamy look.
And I love cilantro and smell this. But again, you're always saying that you don't have to stick with the recipe. So if someone doesn't love cilantro, okay, but this is delicious.
You can always change it up.
You can smell the horseradish. So it's got a little kick to it.
So now what we're gonna do is slice our tuna.
And so you were saying that you also have your app that not just has this wonderful recipe here with our coriander tuna, but there's over how many recipes on it?
We've got a little over 200 now that are Eat Fit approved.
Wow.
So they're not just healthy recipes on there. We've kind of dug through and made sure that the sodium, the added sugar, that all these numbers are in check. So we've got just over 200 Eat Fit NOLA either developed or approved recipes on there, including Chef Will's with Vega Tapas. And we'll have all of our Home and Garden Show chefs on there as well.
And then you also said that you have a fish of the day, and that can change, and sometimes it's Eat Fit NOLA approved and sometimes it's not, but that also gives you one more extra
Exactly. And we have a lump crab salad at Vega Tapas Cafe. So lots of options there for someone who's trying to eat fit.
Yes.
Well, I really appreciate you both being on the show, and this is an absolutely beautiful and smells delicious dish.
Yes. And we also serve it with a cilantro chili vinaigrette.
A cilantro chili vinaigrette.
Which is very great too at the same time.
And again, recipes for all of this on
just
the app.
So
it's a free download.
Just absolutely look how pretty that is. Well, and we'll be right back with more Community Health Heroes.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
Thank you so much for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our website at www.communityhealthheroes.org. You can also find us on YouTube. We hope that the information we provide today will help you and your family live healthier and happier lives. I'm Dr. Penny Walker, and we'll see you next time on Community Health Heroes.